Hi there, I'm Dr. Ryan Herron with MedApplications. In this video, I want to share something that really helped me to prepare for my own medical school and residency interviews. It's called the CanMeds roles. First of all, what is CanMeds? CanMeds is a framework of competencies that are essential to be an effective physician. These competencies are grouped into 7 CanMeds roles, which are Communicator, Collaborator, Leader, Health Advocate, Scholar, Professional, and Medical Expert. The CanMeds framework was developed by the Royal College of Physicians and Surgeons of Canada and is used to guide the training of student doctors as well as in the accreditation of medical schools. So wait, if it doesn't come into play until medical school, why should you bother learning it for the interviews? You see, your medical school interviews will be assessing whether you are a good fit for the medical profession. Knowing the roles medical school wishes to develop and being prepared to articulate your strengths in these areas will demonstrate to your interviewer that you know what you're getting into and already possess some abilities in these important domains. Let's have a look at each CanMeds role in detail, starting with Communicator. As a physician, you will be gathering and sharing information that is important for effective healthcare. This requires strong communication skills. Effective doctors need to explore a patient's symptoms and actively listen to their experience of illness. This includes asking about their fears, ideas about the illness, the impact of the illness, and expectations of care. You may also be gathering information from their family members. Communication also involves synthesizing and documenting accurate and relevant information about medical encounters. This documentation may be done in writing or electronically. You will also frequently communicate with other healthcare professionals. This may be by phone, over fax, or in person. Finally, test results and treatment will need to be clearly communicated to the patient. Remember, informed consent is only valid if the patient understands the information presented and has had all of their questions properly addressed. You're probably asking, how does this relate to my interviews? I want you to think of a time when you demonstrated effective communication skills. Perhaps you worked in an administrative role or as a research assistant and needed to gather and accurately record important information from the public or research participants. Maybe you volunteered at a hospital and engaged with patients, actively listening to their experience of illness. Have you ever done any public speaking? Practice and be ready to clearly describe these experiences that show your strong communication skills. Our second CanMeds role is Collaborator. Physicians must work effectively with patients, their families, and many other healthcare professionals. Collaboration involves constructive negotiation and making shared decisions that respect the values of others. Collaboration also involves recognizing your own limitations and providing appropriate referral. Similarly, you will need to hand over patients to a colleague at the end of a hospital shift. Again, I want you to recall a time you demonstrated effective collaboration skills. To start, it may be easier to ask, have you been a member of any teams? You likely have been a member of a sports team, a band, or a group project in school. Did your team collaborate effectively? Why or why not? Next up is leader. Physicians must be leaders to effectively manage a practice. Whether as clinicians, administrators, scholars, or teachers, physicians are leaders in the healthcare system. Where have you demonstrated effective leadership skills? It may help to know this role is formally titled manager. Did you ever have a job as a manager or supervisor? How did you coordinate the people you were responsible for? Physicians use their medical knowledge, expertise, and their influence to improve the health and well-being of their patients. Accordingly, our next CanMeds role is Health Advocate. Improving health is not just about treating illness. It is also about disease prevention, health promotion, health equity, and health protection. In order to do these things effectively, physicians need to understand their patient needs and take action. For example, by speaking on their behalf, engaging other healthcare professionals, or supporting the mobilization of resources. Can you think of a time you promoted the health or well-being of others, or advocated in support of a cause? Perhaps you fundraised for a charity, or raised awareness of a problem occurring locally or globally. Our next CanMeds role is scholar. In order to maintain the delivery of excellent healthcare, physicians must engage in continuous learning and evaluation of evidence to inform their medical practice. In addition, physicians often engage in research or teaching activities to create and share medical knowledge. When have you demonstrated scholarly abilities? Have you ever been involved in teaching activities or research projects? Perhaps you have given presentations or contributed to a journal. Our next CanMeds role is professional. As professionals providing an essential service to society, physicians are expected to exhibit high personal standards of behavior, to be accountable, and to practice following ethical codes, laws, and standards of practice. Other aspects of being a professional include recognizing unprofessional behavior in colleagues and responding appropriately, as well as the maintenance of personal health and well-being. I want you to recall a time you acted professionally. Perhaps you had a job or a volunteer position that required high personal standards of behavior. What about a situation where you were accountable for your actions? Maybe you took action when a coworker was acting unprofessionally. Lastly, medical expert. Doctors, of course, are medical experts. This role integrates the other 6 CanMeds roles in the provision of high-quality, safe, patient-centered care. Medical expert describes a physician's role in collecting and interpreting information, making clinical decisions, and carrying out diagnostic and therapeutic interventions. I won't ask you to think up an example for this role, as you are not a doctor yet, but if you can, even better. In summary, we discussed the 7 CanMeds roles and what is expected of you as a physician. To review, these were Communicator, Collaborator, Leader, Health Advocate, Scholar, and Professional, as well as the integrating role, Medical Expert. You will also have thought of several experiences where you have demonstrated abilities in these areas. You will be amazed how many interview questions these examples can be applied to. For example, a question could be, describe yourself in 3 words and explain why you chose them. If you don't have 3 adjectives prepared, consider applying your CanMeds roles and experiences. For instance, I'm an effective leader, communicator, and collaborator. I've demonstrated strong leadership skills when I worked as a counselor at a summer science camp. In this role, I had to manage camp groups of 20 children. And so on. Another question could be, what skills or abilities will help you be an effective doctor? I believe I will be an effective doctor because I am a scholar, health advocate, and professional. As a student researcher, my job was too. And so on. Feel free to invent your own CanMeds roles to make your answers more personal and unique. Thanks for watching, and good luck on your interviews.